Is it okay to swallow nystatin? Nystatin oral suspension. Appointments and access. Contact US. What is this medicine? Nystatin, is an antifungal medicine. It is used to treat certain kinds of fungal or yeast infections. This medicine may be used for other purposes. Ask your healthcare provider or pharmacist if you have questions. Common brand name nystatin, Nystex. What should I tell my healthcare provider before I take this medicine? They need to know if you have any of these conditions: diabetes, kidney disease, an unusual or allergic reaction to nystatin, ethylenediamine, parabens, thimerosal, other foods, dyes or preservatives. Pregnant or trying to get pregnant. Breastfeeding. How should I use this medicine? Follow the directions on the prescription label. Shake well before using. Use a specially marked dropper to measure every dose. Ask your pharmacist if you do not have one. Put 1/2 of the dose in each side of your mouth. Switch the medicine around in your mouth and gargle. Hold your dose in your mouth for as long as you can. Swallow or spit out as directed by your doctor. Take your medicine at regular intervals. Do not take your medicine more often than directed. Do not skip doses or stop your medicine early even if you feel better. Do not stop taking except on your doctor's advice. Talk to your pediatrician regarding the use of this medicine in children. Special care may be needed. Overdosage. If you think you have taken too much of this medicine, contact a poison control center or emergency room at once. Note: this medicine is only for you. Do not share this medicine with others. What if I miss a dose? If you miss a dose, take it as soon as you can. If it is almost time for your next dose, take only that dose. Do not take double or extra doses. What may interact with this medicine? Interactions are not expected. This list may not describe all possible interactions. Give your healthcare provider a list of all the medicines, herbs, non-prescription drugs, or dietary supplements you use. Also tell them if you smoke, drink alcohol, or use illegal drugs. Some items may interact with your medicine. What should I watch for while using this medicine? Tell your doctor or healthcare professional if your symptoms do not improve or get worse. If you wear dentures, talk to your doctor about how to clean them.